Hello, today we're going to be looking at the roles and responsibilities of the midwife. This presentation will be looking at recent changes and their impact on the roles and responsibilities of the midwife, the impact of the midwife in meeting the physical, social and psychological needs of a woman and her family, the role of the Nursing and Midwifery Council in relation to midwifery practice, the implications of the Code of Midwifery Practice, the need for effective communication in a multidisciplinary healthcare setting, and finally the effectiveness of the multidisciplinary approach in a healthcare setting. Now we're just going to look briefly at the history of midwifery. Prior to the 20th century, women typically gave birth at home, usually without the help of a qualified professional, and midwives were not formally recognised. This resulted in a high rate of mortality for both mothers and babies. The 1902 Midwife Act created the Central Midwives Board, which included the registration of midwives, better training and the regulation of their practice. Midwives joining the register had to be certified for practice by an organisation such as the Obstetrical Society of London, and by 1905 no one could declare themselves a midwife without being registered. Following the creation of the NHS, hospital births increased, and by the end of the 1950s more women were being managed by obstetricians and midwives as birth and labour had become more medicalised, and women would often remain in hospital for up to a week post-birth. Today, however, women who give birth in hospital spend far less time on the ward and are often released soon after they've given birth. Maternity units and home births have become more popular over recent years and allow mothers and their partners more independence while still being provided professional support and care. In 2016, a national maternity view was commissioned and resulted in the Better Births framework being produced. The framework identified 7 key areas for progress. Personalised care, which caters to the specific needs of the mother, baby and family. Each woman experiences pregnancy differently and there cannot be a one-size-fits-all approach. Midwives need to work the expecting mother to create a care plan that meets all her needs, including what kind of care she wishes to receive through prenatal, intrapartum and postpartum periods, and is representative of her overall health needs. All women should also have access to unbiased and accurate information to assist in making these decisions. Continuity of care, which provides safe care to the expecting mother. The review suggested each woman should have a midwife who's part of a smaller community-based team who should be familiar to the woman and her family and can provide continuity throughout the pregnancy, birth and postpartum. Additionally, each group of midwives should have a designated obstetrician who can provide advice on issues as needed. The midwife should work closely with the obstetric, neonatal and other teams to ensure the mother receives the care she requires. Safer care, which focuses on professionals working together successfully in a multidisciplinary team, which will allow for rapid referral protocols to be in place throughout and ensure that the mother and baby can access specialist care when needed. It's advised that provider boards should have a board-level champion for maternity services who monitors information about quality, including safety, and can take actions as necessary. Better perinatal and postnatal mental health care. The review found a significant level of investment into perinatal mental health services is required to improve the historic underfunding in this area, which can significantly impact the lives and well-being of the woman, baby and family. Looking at postnatal care, women should have access to their midwife and or obstetrician as they require after having their baby, while those who require longer-term care should be provided for via specialist clinics. Multi-professional working and working across boundaries. The review found it important to break down barriers between midwives, obstetricians and other professionals to deliver safe and personalised care. It's advised to have the Nursing and Midwifery Council and the Royal College of Obstetricians and Gynecologists should review pre-registration education to ensure that it promotes multi-professionalism and that there are shared elements where practical and sensible. And finally, a fair and adequate payment system, which compensates providers for delivering high-quality care to all women. The payment system should consider the different cost structures services have and the need to incentivise the delivery of high-quality care of all women, regardless of where they live or their health needs. Additionally, in 2016, the Saving Babies' Lives Care Bundle programme was introduced with a national goal of reducing the number of stillbirths, neonatal maternal fatalities and intrapartum brain injuries in half by 2030, with a 20% reduction by 2020. In 2017, the goal was expanded to include lowering the rate of preterm births from 8 to 6%, and the deadline for this goal was brought forward to 2025. It's important to look at how this will be possible and what midwives can do to ensure these goals are reached. The programme combines 4 aspects of evidence-based care. Firstly, there's a significant amount of evidence that quitting smoking during pregnancy lowers the risk of stillbirth. Other smoking-related pregnancy issues such as preterm birth and miscarriage are decreased if the mother stops smoking. The programme advises carbon monoxide testing of all pregnant women at their antenatal booking appointment to identify smokers and refer them to a stop smoking service. Midwives must have the time and resources to do this test, and they will need enough time to convey important information to the woman. They must also receive training on the use of the monitor itself. CO consumables must also be available on a longer-term basis to maximise their ability to positively impact pregnancy outcomes. The 2019 Saving Babies' Lives Bundle further emphasises the importance of CO testing and advises introducing the testing at the 36-week appointment as well, in addition to the booking appointment. There's a huge amount of evidence that fetal growth restriction is the leading cause of stillbirth. The programme advises using the following algorithm to aid decision-making of risk. Midwives should be competent in measuring fundal height for both low and high-risk pregnancies. Currently, the only way to manage growth restrictions is to deliver the baby. Therefore, antenatal detection of growth restriction is vital and has been proven to reduce the risk of stillbirth, as it gives the option to consider an early delivery if babies at risk. Looking at the 2019 volume, midwives should now also assess whether a prescription of aspirin at the booking appointment is appropriate. Thirdly, the programme suggests raising awareness of reduced fetal movement. It's incredibly important for pregnant women to be aware of what to do if they detect reduced fetal movement by the 24th week of pregnancy. It's the responsibility of the midwife to inform the pregnant woman about reduced fetal movement based on current evidence, best practice and clinical guidelines. This should be provided in the form of an advice leaflet. And lastly, effective fetal monitoring during labour. Cardiotocograph is a common and well-known way of confirming fetal well-being and screening for fetal hypoxia. It's the most accurate way to monitor a baby during high-risk labour. However, it is a high-level skill, subject to variation in judgment. The programme informs that midwives are required to undertake an annual training and competency assessment on CTG interpretation. Following the introduction of this care bundle, the Tommy Stillbirth Research Centre was commissioned to evaluate the programme in 19 NHS trusts, and they found the stillbirth rate had declined by 20% in those participating. The NHS has worked to implement the changes suggested in these publications, and the 44 local maternity systems across the UK are driving these advances. Most recently, an initiative which has not yet been implemented but is being worked towards is the Midwifery 2020 Delivering Expectations. The initiative focuses on these 5 key work streams, and we'll look at a couple of these in detail. Firstly, the core role of the midwife is to enable all women and their families to have a positive and safe experience of pregnancy, birth and early parenting. Each woman and her partner need a midwife they know and trust to help coordinate their physical and emotional care through pregnancy until the end of the postnatal period. The midwife is the lead professional for women with no complications, and women should have easy access to their midwife as the first point of care during pregnancy. Secondly, it's important to develop the midwife's role in public health and address health inequalities. Midwives provide a unique contribution to public health as they collaborate with women throughout their perinatal period. For the best outcomes, the midwife needs to be rooted in the community where the woman and her partner live, and the midwife should have a good knowledge of the health and social care needs of the local community, be well networked in the local system, and be proactive at identifying women at risk. Midwives should also use their advocacy role for influencing and improving the health and well-being of women, children and families. Each pregnancy is different, and each woman has different needs during her pregnancy. The midwife therefore plays a key role in supporting the physical, social and psychological needs of the woman and her family during the perinatal period. The midwife is responsible for developing a trusting and open relationship throughout the pregnancy during regular antenatal appointments, which are usually every 4 to 6 weeks, up until week 34 when they're held fortnightly. During the initial booking appointment, the midwife starts to build a relationship with the expecting mother and will assess the woman's physical, social and psychological needs. The midwife will do this by performing a risk assessment, which will inform the midwife and pregnant woman of her options regarding her maternity care and what risk level she is. The assessment is organised into the following categories. General, which includes factors such as the mother's age, BMI and smoker status. As older women, those who are overweight and those who smoke are at higher risk and need to be carefully monitored. Previous obstetric history. This includes factors such as previous stillbirth or premature baby, as women who've experienced these in the past have an increased risk of it happening again. Thirdly, the assessment will look at the woman's previous medical history. Factors such as heart disease, diabetes and epilepsy put the mother at higher risk. If any of these conditions are present, the woman must be monitored throughout her pregnancy. The woman's family history allows the midwife to see if there's a history of conditions such as sickle cell disease or cystic fibrosis, which can often be genetic. If the woman's family has a history of these conditions, Testing will take place in the form of blood or tissue samples to confirm whether she carries these genes. And lastly, the midwife will look at the mother's present obstetric history, looking at factors like how many babies she's carrying or if she has preeclampsia. All of this information is important in determining whether the pregnant woman is low or high risk and what sort of care she requires through her pregnancy. The risk assessment also identifies if there are any psychological stressors which may affect her pregnancy, including but not limited to her job, housing situation, risk of domestic abuse, and mental well-being. Women are often anxious about birth, especially with their first child, and a midwife is responsible for supporting the woman in creating a birth plan with information such as where she'd like to give birth. In low-risk women, they can often choose between in-hospital, a midwifery unit, or at home, and the type of birth experience she'd like to have, such as who she'd like with her, her preferred position for birth, and who cuts the umbilical cord. The midwife will also provide information about what to expect during 3 stages of labour, pain relief options such as Entonox, epidurals, and relaxation techniques, to name a few, and birthing equipment which may be available, such as a birthing pool. The onset of labour is an exciting but stressful time for a lot of parents, and a midwife can provide physical, social, and psychological support for women and their families through practical advice, emotional reassurance, and detailed, accurate information to help guide them through. Being prepared for labour and childbirth is important as it helps the woman and her partner feel confident about what's happening and what to do. For example, knowing who to contact when labour begins and the location of the hospital or maternity unit if they're going to one. The midwife will also refer the pregnant woman and her partner to antenatal appointments which help them learn and understand in detail the options for labour and birth, as well as provide valuable information about how to care for and feed a newborn baby. These classes also offer parents a chance to make new friends. Once the baby is born, the midwife plays a vital role in supporting the physical needs of the mother and family. The immediate postnatal period can be particularly challenging, and mothers often neglect their own needs while adjusting to the demands of caring for a newborn baby. The midwife will continue monitoring the mother's physical health, such as the sleeping pattern and diet, as well as provide advice on healthy eating and establishing a daily routine. The midwife will also continue examining the mother's uterus, lochia, perineum, and breast to evaluate how she is recovering from childbirth and ensure there are no signs of infection. During the postnatal period, the midwife will also check on the mother's psychological health. Parents can sometimes struggle due to the demands of a new baby, and the midwife must follow the guidelines of the NICE Quality Standards of 2015 to ask women about their emotional well-being and what support they have in place, to be aware of signs and symptoms of maternal mental health problems, and to ask about the resolution of the baby blues around 2 weeks after birth. If the symptoms haven't been resolved, the woman should be assessed for postnatal depression. The midwife will also provide support for the baby's physical needs during this time, such as providing advice about breast or bottle feeding and helping the mother establish a feeding routine. The midwife will regularly monitor the baby's weight gain and perform a hearing test a few weeks after birth using a handheld machine which sends a small clicking sound into the baby's ear. The midwife can provide advice and information about the baby's bowel movements and optimum sleeping positions and factors which increase the risk of sudden infant death syndrome. Discussion of the role of the Nursing and Midwifery Council in relation to midwifery practice. The Nursing and Midwifery Council is the regulator for midwifery practice in the UK and has been since 2002. The key duties of the NMC are setting and reviewing standards for education and training, conduct and performance, investigating allegations of impaired fitness to practice, and maintaining a register of all midwives eligible to practice in the UK. The NMC sets education and training programmes which affirm the competencies and skills that a midwife is expected to achieve. These regulations ensure midwives can deliver safe, effective and accurate perinatal care to women. Midwives are expected to have a comprehensive understanding of antenatal, intrapartum and postnatal care, including monitoring of the physical and emotional needs of the mother and examinations of the developing or newborn baby. They must also recognise emergencies and escalate accordingly. Midwives must also be educated in effective communication skills, working with others, and record keeping. Conduct and performance. Through the perinatal period, midwives must be capable of meeting competency and essential skills within their practice. They must ensure the woman and baby are their priority, and the midwife must work in partnership with the mother and her family to provide safe and compassionate care. A midwife must only administer medication which they've received training to use and ensure all records relating to the care of the woman and baby are stored correctly and concisely. And fitness to practice. All qualified midwives must follow the code Professional Standards of Practice and Behaviours for Nurses and Midwives. It's essential that midwives keep their knowledge and skills up to date and that they know what is expected of them during each stage of pregnancy. The NMC will investigate any allegations made against a member if it's suspected that they do not meet the required standards for education and behaviour. If at the end of the investigation and hearing process, a midwife is found to have provided services which do not meet the required standards, then sanctions may be imposed on that midwife. Introduced in 2015 and updated in 2018, the Code of Professional Standards of Practice and Behaviours for Nurses and Midwives is the moral and ethical expectations that must be upheld to be registered to practice in the UK. The code is set into 4 key sections, which are prioritising people, which is as it sounds, putting its service users first, prioritising their needs and welfare, showing them respect and providing care without prejudice, as well as informing and supporting women in their decisions and respecting their service users' right to privacy and confidentiality. Practice effectively. Midwives must assess needs and deliver treatment. They must always practice in line with the most current evidence, communicate clearly, work cooperatively and be accountable for their decisions. Preserve safety. Midwives must ensure public safety is protected. They must work within the limits of their competence to avoid unnecessary mistakes and dangers to women or babies. And they must be open with all service users about aspects of care and treatment, including when mistakes have taken place. And lastly, promote professionalism and trust. Midwives must always uphold the reputation of their profession. They must keep the registration up to date and cooperate with all investigations and audit. They should be the model of integrity and leadership for others and make sure people's well-being is protected. The code acts as a protection to the public so people are not able to practice if they're not fully trained to the highest standard. By joining the register, you're committing to always adhering to these requirements. If you're found to not be practiced in this way, you're at risk of prosecution and removal from the NMC, meaning you would no longer be eligible to practice. There are 4 types of teams: permanent, interdependent, cross-functional and multidisciplinary. There are 4 types of teams: permanent, interdependent, cross-functional and multidisciplinary. Within a healthcare setting, people are most likely to be working as part of a multidisciplinary team, which is a group of professionals who are members of different disciplines. For example, obstetricians, nurses, midwives and GPs. Effective communication is incredibly important in this setting. Patient safety and care is at the centre of the healthcare professional's work, and effective communication protects the patient from any potential harm arising due to misunderstanding. With members of the team, effective communication allows everyone to collaborate and combine their skills, knowledge and expertise to meet the health and well-being needs of their patients. Additionally, by communicating effectively, it's easier for information to be shared to allow for good decision-making and team working. When healthcare professionals are not communicating effectively, patient safety is at risk as critical information could be missed and in the worst case scenarios could result in an unavoidable death. It's important to use appropriate language with patients and ensure they understand what you're saying and are meeting their language needs, as well as communicate non-verbally, for instance through touch and body language, which helps the patient feel cared for and allows a better relationship to be built. Clear communication is emphasised throughout the NMC code as they recognise the importance of ensuring patients and other team members understand them. Effective communication helps to build trust and confidence in not only the midwife but also the healthcare system. This is crucial for cooperation and disclosure of information, and it also allows teams to reflect and learn from each other. When looking at the effectiveness of the multidisciplinary approach, it's important to look at the positives, limitations and overall effectiveness. Firstly, the approach makes it easier to achieve continuity of care, which helps with patient confidence and improves the overall care of the patient. Additionally, this approach helps ensure treatment is effective, as decisions are based on many, each with a unique education and knowledge set and not just one opinion. It also allows resources to be used effectively, as knowledge, expertise and equipment can be easily shared. However, this approach does have limitations. There can be lots of personality, backgrounds and experiences which can clash and cause difficulty defining the boundaries of the team or discrepancies in what treatment's needed. Additionally, if a team has an underdeveloped leadership, professionals are likely to feel lost and without direction, which can negatively affect the patient's outcome. Lastly, if different services have different shift patterns, it makes it difficult to communicate effectively, which will hinder progress and waste valuable time. In terms of effectiveness of this approach, it does improve the quality of care and experience of the service user, as it empowers them to be an active partner in their care. Additionally, it allows staff to focus on the individual areas of expertise while also encouraging innovation. To conclude, a midwife has a wide range of roles and responsibilities which vary dependent on which service they're providing. They have changed and grown over time to provide the best care possible to mothers, babies and families. Guidelines and a code of practice are in place to support midwives to provide this level of care and to ensure patients feel safe and confident in the care they receive. The use of a multidisciplinary team in a healthcare setting does allow for the safe care of patients and is generally effective. However, it does come with limitations which must be improved upon to continue providing the best care possible.